According to the National Institute of Neurological Disorders and Stroke, carpal tunnel release is one of the most common surgical procedures in the United States.
And that's a constellation of symptoms of hand pain and numbness and tingling that occurs in the hand. The patient typically experiences worsening of symptoms at nighttime. It can actually awaken them from sleep, and they feel like they have to shake their hand over the side of the bed.
Dr. Peter Jebson, the chief of the Department of Orthopedics at Spectrum Health, says a procedure that used to require sedation can now be done in less than an hour right in the doctor's office.
So we've transitioned into this program of wide-awake local anesthesia, no tourniquet in the office, which delivers true value for patients. First of all, it's safe, it's extremely well received, it's cheaper, it's much more convenient for patients.
Patients don't need a referral from their primary care doctor, and there's no need to have prior lab testing.
They can actually come in, drive themselves. They can go home the same day. It's done with local anesthesia only, and so there are none of the secondary effects of sedation, feeling nauseated or unwell.
More patients are also eligible for the office-based surgery because there's no anesthesia involved.
In patients who are even on oxygen or on blood thinners or have significant comorbidities, we just don't need the testing, nor are we concerned or alarmed by any of those conditions.
Doctors inject lidocaine and epinephrine to numb and restrict blood flow, then wait 25 minutes for it to take effect.
The surgery itself for carpal tunnel takes about 10 minutes, a trigger finger about 7 minutes, and a Dequa veins release about 15 minutes.
Office-based hand surgery is also approved for patients who suffer from trigger finger.
It's a locking of the finger in flexion, and the finger can actually snap or catch, and it's painful, and it can interfere with function, particularly when you're grasping something and then trying to release it. The pain is problematic.
Another advantage for patients is the cost. Savings can range between $2,200 to $2,800 per procedure when compared to surgery under general anesthesia.
Can I get value for the amount of money I spend out of pocket? We know that there is a shift of responsibility to patients with higher copays and deductibles. We know that the outcome is the same when you perform these surgeries in the office, and therefore it delivers true value for patients.
Dr. Jebson says they can even try to accommodate any special requests during that surgery.
So I recall a lady who had bad carpal tunnel, was very fearful of undergoing sedation, and agreed to have the carpal tunnel surgery done in the office only if her husband could play the accordion in the background. It's unconventional, but it worked, and she had a great outcome.
In Grand Rapids, Annie Satowski, Box 17 News.